are really excited to have our own Jerry Antamano, who's a senior manager at the lab in community development, talking to an executive from Novo Nordisk about global innovation in medical devices. Jerry, handing it over to you.
No, thanks very much, Stan. Really awesome open to the August Symposium for today. And who better to talk to about global innovation and medical devices than Andrew Gvozdanovic, International Medical Manager at one of the leading life science companies in the world. Andrew, pleasure to have you on the program. Thanks so much for coming on. For those in the community that don't know you very well, we'd love to get a quick 30-second background on what you're currently doing at Novo Nordisk.
Hey, yeah, great pronunciation of my second name as well. You didn't even stumble. So I'm Andrew. I joined Novo Nordisk just under 6 months ago now. I sit within something that's quite unique to them, which is medical and sciences. So it's predominantly clinicians that work across development, from early development all the way to kind of later development. And I specifically sit in a group called Devices and Digital Health, where we do everything from trial design all the way through to kind of clinical evaluation. And by background, I've worked in strategy and design for multimodal data analytics platforms. I've worked as product in digital health and across clinical regulatory and startups. So it's great to be here.
No, wonderful to have you on. We should get right into it because I know we only have a limited time and there's definitely a lot we want to cover. But I think what we should start off is getting your insights around key trends, especially around sort of global innovation and what's shaping that at the moment in terms of medical devices and digital health. And for the startups on the program today, I'm sure they'd love to hear about how they can adapt to those trends to continue to stay competitive.
Yes, I think there's a whole load of trends going on at the moment, and Stan's already alluded to one of them. And it's that kind of health democratization. And I think part of that comes from, the lagging effect of the burden on the healthcare systems. But, if we kind of talk initially around democratization from the pharma perspective, as he's already mentioned, we've had Lilly Direct at the start of the year, kind of a direct-to-consumer platform. Pfizer's followed suit, I think just this week, with their Pfizer for All. And so what we're now seeing is that bigger players, as well as some of the smaller players, are kind of realizing that there's opportunity to be had by going directly to people who care more about their health now. And I think part of that is because of the lagging effect of reimbursement, although we have seen some good movements there too. But, we're seeing great success from small players such as, well, not so small now, but Noom, who kind of do the health and fitness and diet tracking, who've gone D2C, even people like Nintendo, have a foot in the game now with Pokemon Sleep, which has been a great success. And it's not just in digital health, we're seeing that in devices too, with both Abbott and Dexcom both getting kind of a D2C CGM approved this year too. And I think that this kind of goes hand in hand with, this moving away from living just from kind of longevity health and more into a view around healthy aging. So people are really taking much more interest in terms of how can we live not just longer, but better. And that kind of flows into another one of those trends, which has been here for a while, but it's kind of now getting a little bit stronger, which is those around wearables. And we're seeing that not only in the consumer space, but also, again, in much more regulated spaces too. So big players such as Apple and Samsung have both had great moves this year as well, with the Apple Watch getting AFib burden approved by the FDA, and the Samsung Galaxy Watch getting de novo authorization for sleep apnea. So again, I think we're seeing some really great moves there too. And I mean, just broadly across the industry, I think digital health and medtech, there are some really cool trends going on across femtech. You can't move without running into AI, and in particular large language models at the moment, and things such as surgical robotics, which Neuralink is all over the news too. So I think there's some really big trends, but they're all kind of underpinned by democratization of health and people wanting to live better.
Yeah, you definitely mentioned a lot of key trends that are happening right now that I think a lot of the startups are keeping track of. I know we had some advice given from one of the executives from Mount Sinai earlier, a major health system, of course, within the US. From the life sciences point of view, what advice would you give to entrepreneurs right now who are looking to disrupt sort of the traditional medical device markets at the moment, or digital health landscapes?
Yeah, I think in terms of staying competitive, it's remembering that trends are trends. So, when we talk about AI, the AI is not the product. The product should be fixing something. It should be, answering an unmet need. So you should be, trends are by means transient. So if your entire product or business is a trend, then it is transient by nature. And so I think the key is to try and identify a problem and apply, the trend almost to it, if you see what I mean. So, I mean, if you look at, there's a company called Scala in the UK who identified that medical regulation is hard. People have problems with it. So they brought a technology solution to that problem. But they didn't just bring the technology, they brought around all the wraparound services you need to make that successful. And, by doing that, they really cement themselves in the market and give themselves a much better chance to be successful when, the hype around something goes away. I think that's really important.
Yeah, no, that's absolutely key, I think. And, there's often the need for sort of startups to consider, a lot of different things when they are either starting out or they're in their growth stages. How can they sort of balance that need for the innovation piece of their business and their technologies compared with the sort of the rigorous sort of regulations and safety standards that are required right now in the medical device industry as you see it?
Yeah, I mean, it's a tough question because, clinical safety and regulation, those standards are there for a reason. And, sometimes they are overbearing, sometimes they slow things down. I think the key is to innovate freely in a sandbox environment at the start, make your mistakes, talk through your ideas with stakeholders, have that ideas box and keep those regulations and standards in mind so that when you go to that next step around how do we, design this, what does that roadmap look like? Those steps and those things are still there. So it's almost built in by design, because otherwise what you'll have is, yeah, fine, you'll advance really quickly to begin with. And then when it comes to crunch time, you're unsuccessful because one, no one's going to buy you because you're not fit for purpose. And two, you don't have any of the evidence to demonstrate that you're any good. And so I think it's really around, yes, it is maybe slower in the long run, but it's really the key to success if you're looking to be a long-term player.
Yeah, I mean, always easier said than done, right?
Yeah.
In terms of putting it into actual practice and stuff. I know we only have about a minute left, and I really wanted to ask you this specific question on, the list of questions that we could go through. But, AI is a really big thing at the moment, of course, across all sectors. And we'd love to get your insights on how you foresee the integration of AI and machine learning, evolving in sort of the medical device space and the digital health sectors at the moment.
Yeah, again, I think that the question's so linked to the previous one, which is that there's a lot of potential, there's a lot of hype. We have to learn from the mistakes of the digital health boom and bust, which is not bust, but the kind of burst over the last couple of years in terms of investment, where people really want to see that there's a long-term plan. What's the market fit? What's the unmet need? What's the route to success, and actually, bringing in some revenue, making a return, because it's not enough just to bang in, AI here and AI there. It'll be the same as digital health again, where, we're looking a few years down the line and you have big, some of the leading players at the time, like Babylon, who, disappeared. And so I think it's be smart, don't make it, your only answer. Make it a solution, think about the long-term integration. It's all planning.
Yeah, no, that's brilliant. That's actually, I think, really sound advice in in any capacity for all the folks that are listening in the program. Andrew, I'm sorry you've run out of time. I know we had lots more to get through. I definitely welcome you to answer some of the questions that have popped up in the chat after you've hopped off this segment, but really appreciate you coming on and taking the time to share your insights with us. And always a pleasure to have a fellow Brit on the program as always. Back to you, Stan.
Nice to speak.